Hello, good morning. My name is Danielle. I'm the nurse that's going to be taking care of you today, okay? I'm quickly just going to wash my hands and pull a curtain for privacy. Can I get your full name and date of birth for me?
Delmar Allen, April 20th, 1993.
Okay, perfect. So what I'm going to quickly just do is do an assessment of the room. I just want to make sure that there's nothing that's going to create any harm or danger to you or myself during this assessment that I'm going to do. Okay, and what I'm going to do is just a quick head to toe assessment today. It should take about maybe 10 minutes. Okay, are you experiencing any pain, discomfort, anything that I need to be aware of prior to this inspection? Okay, great. So can you please tell me currently where you're at?
The hospital.
And what season are we in?
Winter.
Okay, perfect. So patient is alert and oriented to location and time. The patient has a relaxed posture and good hygiene today. I don't see any use of accessory muscles. Patient doesn't look exertion on inspiration and expiration today. Color of skin is appropriate for ethnicity. It's nice pink and warm. It is dry. I don't see any discoloration, any visible lesions today. So what I am going to do is just a quick assessment of your head today to start off with. Okay, I'm going to have you take your hat off for me. And then I'm just going to feel around. You're going to feel me looking and just feeling your head for any lesions, any tenderness, any masses of any sort, and I don't see any. I see a nice even distribution and symmetry in your hair distribution for your eyelashes, eyebrows, and hairline today. Okay. So the next thing I'm going to do is just do a quick assessment of your sensation of your face. Okay. I'm going to have you tell me where you feel my pen light.
Forehead. Cheek. Chin.
Okay, great. So cranial nerve 5 is intact. I'm also going to pull down on your chin. Try to keep it closed for me. Perfect. Cranial nerve 7 is intact today as well. So next thing I'm going to do is just a quick assessment of your eyes. Okay, patient's eyes are nice and symmetric. I'm going to pull down on your eyelids just a little bit, just so I can see. There is no redness, no discharge. I don't see any lesions at all that I would be concerned about today. Okay, so I'm quickly just going to check for accommodation, pupillary accommodation. Okay, I'm going to have you keep an eye on my pen light. Perfect. And I'm going to have you stare at this on that back wall. Okay, so stare at that back wall, and you're going to see. Let me just bring this perfect right in front. So cranial nerve 3 is intact today. And the next thing I'm going to do is just a quick 6 cardinal gaze test on you, okay? So you are going to follow my pen light only with your eyes. Try not to move your head for me, okay? Great. So cardinal, your test today was appropriate, what I would inspect. So cranial nerve 3, 4, and 6 are intact today. The next thing I'm going to do, I am going to get behind you really quick, and I am going to do a confrontation test. So I am going to check your peripheral vision. You can sit on back for me. And let me know when you see my fingers, okay?
All right.
Okay, so patient's peripheral vision is a nice 90 degrees. Cranial nerve 2 is intact today. So the next thing I'm going to do is check for your nose. I am going to check just for symmetry, that there's no obvious lesions, deformities. I don't see any discharge, no bleeding. I am going to have you just smell. What do you smell?
Alcohol.
Okay, cranial nerve 1 is intact today. Next thing I'm going to do is check your mouth. I don't see any lesions, no discoloration. I am going to pull down. Gums are nice and pink. I don't see any bleeding, no hardware today. I am going to have you open up your mouth and go, ah. Perfect. So your uvula rises with phonation. Cranial nerve 9 is intact. I am going to have you swallow for me. Perfect. And I am able to see that your cranial nerve 10 is intact. And also, cranial nerve 9 is intact. The uvula is cranial nerve 10. And I didn't feel any enlargement of your thyroid today, okay? Next thing I'm going to have you do is just stick your tongue out completely. Perfect. And tongue is midline on protrusion. Cranial nerve 12 is intact today. And the next thing I am going to check is just your hearing. So I do want to first just assess, and I am assessing bilaterally. I don't see any excessive cerebrum. I don't see any lesions, discharge. Do you feel any tenderness? No, perfect. Okay. The next thing I'm going to do is just test your gross hearing today. So I'm going to do what is called a finger rub test. I'm going to have you tell me where you feel my fingers rubbing.
Right here. Left ear. Both ears.
Okay, perfect. So patient's cranial nerve 8 is intact today. And the last one that I'm going to do is quickly just, I'm going to have you shrug your shoulders up for me. And I'm going to have you push against my hand and push against my hand. Great. So patient's cranial nerve 11 is intact today. So the next thing we're going to do is go on to your I'm going to do a quick assessment of your lymph nodes today, okay? So I am going to feel for your tonsillar, submental, submandibular, your preauricular, postauricular, anterior cervical, posterior cervical, occipital, and supraclavicular, okay? I'm unable to palpate. That's not an abnormal finding. That's actually an expected finding for us today. There is no enlargement of those lymph nodes today. So the next thing I am going to quickly do is just do an assessment of your thoracic area, okay? I see a nice symmetry of 1 to 2 on your anterior, posterior, transverse diameters today. Again, I don't see the patient having any difficulty with his breathing. There's no use of those accessory muscles today. What I am going to do is come back here. I'm going to have you turn around for me. Perfect. And I am going to check for thoracic expansion today, okay? So what I'm going to have you do is just take a nice deep breath in and out. You can do it quick. Thank you. One more time. Perfect. So there's nice even distribution on expansion. And then the next thing that I'm going to do today is just a tactile firmitis test. So what I'm going to do is check for vibrations in your lung fields today, okay? So as soon as you hear and feel my hands on the back of your back, I'm going to have you say 99 for me, okay?
99, 99, 99, 99, 99.
Okay, perfect. So there's nice even symmetric vibrations through all of your lung fields today. And then I am going to quickly just do an assessment. I'm going to listen to your lung sounds, okay? I'll start off with your back since I'm back here, and then I will move to your front today.
Right.
So I'm just going to have you take a nice deep breath for me. I don't have to do it every time. Perfect. I'm going to get you underneath your armpit area. Perfect. And I'm going to have you turn around for me. And I'm also going to listen to your front, okay? Okay, perfect. Patient is negative for any sounds of wheezing, stridor. Patient has nice, even inspiration and expiration today. So the next thing I am going to do is a quick assessment of your cardiac system, okay? So I am going to want to, again, quickly, I'm going to listen with my stethoscope right on your carotid artery today, okay? It is going to be a little cold. It is on skin. I'm going to take a listen over here. Okay, perfect. So no bruise noted on auscultation. Next thing I'm going to do is just palpate that carotid artery. And what I'm doing is just feeling if there's any bruise. And patient is negative for bruise today. Next thing I'm going to do is just take a listen to your carotid arteries today, okay, your valves. So I'm going to come over here, again with my bell, And listen to your aortic, pulmonic, Erb's point, tricuspid, and mitral valve today. And S1, S2 noted, no S3 or S4 gallop sounds noted on auscultation today. So next thing I'm going to do is an assessment of your abdomen, okay? So you are going to, I'm going to feel and I'm going to listen, okay? Are you having any discomfort or you're still doing okay? Okay, perfect. So patient's stomach is nice and flat. I don't see any obvious distension at all. So I am going to now quickly just listen. And I am listening for 5 minutes of patient's bowel sounds today in all 4 quadrants. And patient has a nice 14 bowel sounds per minute, which is an appropriate finding. The next thing I'm going to do is just palpate for any tenderness or distension today, okay? Sorry, I know it's a little uncomfortable. Okay, perfect. And then I do have to get a little bit of information from you. Have you experienced any pain, any constipation with your bowel movements? Anything abnormal? No. Are you regular? Every day? Every other day?
Every day.
Every day, okay. And any pain on urination? Any differences? Urine's nice, clear, and a pale yellow?
No.
Yes, okay. Alrighty. So patient is showing appropriate and expected finding for those bowel habits today. Okay. So the next thing I'm going to do is just do a quick assessment of your muscles. Okay, so we're going to test strength. I want to make sure that you have sensation, that there's nothing we need to be concerned with there, okay? So on inspection, patient's skin is nice and warm, pink. I don't see any discoloration, no tenderness. I also don't see any obvious lesions today. Do you feel any tenderness, any discomfort in any of these? No? Nothing down here? No? Okay, great. So I am going to quickly do a strength test. So I'm going to have you squeeze 2 fingers for me. Okay, perfect. And then I'm going to try to keep me from pulling. And I'm going to push. Okay, so patient has appropriate strength of upper arms. And now I'm going to have you try to lift your leg. Perfect. And lift this leg. Great. And then I'm going to have you act like you're driving a car. Push down. I'm going to have you do the same over here. And then push your feet up towards the sky. Feet up towards the sky. Perfect. Okay. So patient has a good strength in all extremities. The next thing I'm going to have you do is follow what I'm going to do. I'm going to check your range of motion today, okay? Have your neck, so I'm going to have you put your neck down and back. And then side to side. And chin to shoulder, chin to shoulder. Okay, perfect. Next thing we're going to do something similar with your hands. We're going to stick them out in front of you. And you put them up and to the side. Perfect. And then I'm going to have you take your leg, put it out to the side, and as far over midline as you can. So about right here if you can. Okay, great. I'm going to have you do the same with that leg. Okay. Thank you very much. So patient has appropriate range of motion in all extremities today. I do want to check for capillary refill, and I'm doing this bilaterally. Patient has a nice 1 second, another nice 1 second capillary refill today, which again is an expected finding. I'm not worried about any difficulty with your circulation. Okay. So the next thing I'm going to do is check for your deep tendon reflexes today, okay? I'm going to hold your arm. Just relax it for me. Let me completely support it. I kind of want you like a limp noodle, okay? All right, so I'm going to have you hold on right here, and I'm going to check your bicep, tricep, and I'm going to hold your finger for me, your And then we're going to do your patellar. I'm going to do your Achilles tendon and your plantar today. Okay, perfect. So the next thing we're going to do is your pulses today. I already did your carotid earlier, so I know that was nice and good. This one I'm going to do your brachial, your radial. We're going to get behind your knee here, and this is going to be your popliteal, your posterior tibia, and I'm going to put your shoe off really quick for me. And right up here is going to be your Dorellus pedius, right up there. Okay, so perfect. All of your pulses are a good 2 out of 4. That is what we would call a normal or expected finding today. Okay. And the next thing we're going to do and that actually is going to conclude our assessment today. Okay, are you feeling any discomfort, any pain? No? Okay, great. So I'm going to just wash my hands. I am going to pull your personal side table with all your personal belongings on here. Here is my your call light. If you need me for whatever reason, please call that. Press that button and I'll come in as soon as I can. Okay? Would you like the door open or closed for privacy today? Okay, perfect. Well, if you need me, just press that call light. Otherwise, I'll be back in about an hour to check on you. Okay, thank you. Oh, you gotta be kidding me.